So one of the questions we often get asked is, how do I know whether my symptoms are due to porphyria or not?
Yes, that's a good question, Liz. It's very, very difficult. And the reason I think it's particularly difficult in porphyria is that the main symptoms in porphyria, so pain, nausea, sickness, constipation, fatigue, are all things which happen in a lot of other conditions as well as porphyria. So we call them, they're non-specific. They're not specific for porphyria, and they can happen in other things as well. So how do you know? Well, I think the first thing is you need to make sure we're considering those other diagnoses as well. So we're always, whenever somebody presents with those symptoms, we need to always be thinking, what else could it be as well as porphyria? Could it be gallstones or a urine infection or appendicitis or anything like that? And make sure that the relevant tests are done to exclude those. And it's particularly important because some of those conditions require urgent treatment. So it may be frustrating if you say to your doctor, I'm sure I'm having a porphyria attack, and we say, oh, actually, we want to do some other tests. It's not that we don't believe you, but we want to make sure that none of those other conditions are happening. And we want to make sure you get the right treatment. We're not missing something. But if you have a porphyria specialist and you want to get advice from your porphyria centre, that would be a good point to do that if you're not sure, and we would help you try to decide. And sometimes we might run a urine PBG test to, in some cases, to try and help us decide if it's porphyria or not.
Yeah. And if you're convinced it is a porphyria attack, at what point should people consider going to hospital to get treatment rather than dealing with it at home?
Yeah, that's another difficult question. It's an important question. So I think if the symptoms are persistent, and if you have persistent and severe pain and vomiting particularly, then you need to go to hospital. And if you have treatments at home, by all means take your normal usual treatments. But if the pain is not helped by taking the treatments you usually take, or the sickness, then at that point you certainly need to go to hospital, or at least get some advice from your porphyria centre or your GP, or else go straight to hospital. Yeah.
Thank you. And what causes the pain to happen in acute porphyria? That's something people often want to know about.
I think there are two types of pain in porphyria. So there's what we call acute pain and also chronic pain. So acute pain is the pain that occurs in an acute attack, and we believe that this is caused by the overproduction of chemicals that are toxic to the nerves, and they result in pain. And this kind of pain is very, very severe and intense, and it will last for the duration of the attack, but it can stop actually quite abruptly at the end of the attack and will go away completely when the attack is treated. And an acute pain in porphyria will respond very well to either opiate pain relief and also to hemarginate. Yeah. And then the other kind of pain, chronic pain, this pain is, we believe, is the result of damage to nerves caused by having porphyria attacks for many, many years. So we mostly see it in people who either have recurrent attacks or who've had a lot of problems with porphyria in the past or from many years ago. And we think that those many attacks have actually, over a period of time, caused some sort of irritation to the nerves that results in pain. And this kind of pain is very, very difficult. It tends to be there. Unlike the acute pain, which is there very intense and then goes away, chronic pain is there all the time to some extent, and it can be very, very severe as well. It's always there, but it does tend to vary in intensity. So sometimes it's severe and sometimes it's more manageable, but it's always there. And we find that this chronic pain doesn't respond very well to opiates or to hemarginate, and we have to try and use other techniques to help people with that.